Well, good morning. My name is Greg Sizemore, and I would like to invite you to join in on what will be a terrific webinar that's about to begin momentarily. I'm the Executive Vice President of the Construction Users Roundtable, and this series of webinars, which you have joined, is a part of a series entitled Construction in Crisis, a CURT response, or an owner response, if you will. The purpose of these webinars is to bring you in this very, very critical time information, resources, and perspectives from our members and from other resources that we feel will help you be a more well-rounded, better, more well-informed decision maker. Kurt's always said we have three things, and three things alone we offer, and that is perspectives and resources and the experiences of each other as we network together. And that's what we're going to do here in the webinar, which will begin shortly. I'd like to pause and thank our sponsor, the NCCER, the National Center for Construction Education and Research, whose generosity makes these kinds of things possible. I also want to thank you, our CURT members, for your continued support. I think CURT's going to emerge from this stronger than ever. I think what we offer in terms of services and products and the connectivity we bring is going to be in more demand than ever. And I want to thank you for your CURT membership. Be advised that our offices are open every day from 9 to 5. Our staff is working remotely, and what we're doing is directing our phone calls to the appropriate staff member. Also, you can access us on our website at curt.org and connect with us that way. As we start this seminar, I want to invite you also to stay to the very end if you can. What I have found out in the last 3 or 4 of these that we've done is that often the richest, most valuable information comes as we interact with each other and ask questions of our presenters. So please join us to the very end. We'll have a hard stop right at noon Eastern time. Later today, what you're going to receive is a register to this seminar. You'll receive the biodata sheets of all of our speakers, contact information on all of our speakers. You'll also receive the complete set of slide deck that each of our presenters is using, as well as a recording of our time together for you to distribute internally to your organization, as well as every kind of valuable information we can share. Give us till close of business today to provide that for you. But if you have any questions, feel free to call the office. You'll have that piece coming out to you, etc. Please make sure that your video and your microphone are muted. Your video is disabled. That will provide a better experience as we begin to turn this over to our speakers. We have with us Herb Strong, who's a client services manager at Hastech. Hastech's been a long time member of CURT as an associate member, and Adele Abrams is with us today, and she's going to be explaining the OSHA guidelines that are important to know and to be aware of, to be on top of during this pandemic. Kevin McMahon, also from Hastech, will be discussing how to implement those guidelines in the construction environment. I'll also let you know that we have a chat box that is at the bottom of your screen. If you click on your screen, you'll see a chat box right about there. We invite all your questions in the chat box. Staff will be monitoring the chat box as well as every presenter. They have access to that. And then at the end, we'll answer some of those questions. If your question does not get answered, then Rana from our office, as well as Rob, will make sure that you have your question answered as you have asked it. So let's get started right now and redeem our time together. And with that, I'd like to turn the screen over to Miss Adele Abrams. Adele?
Hello, and good morning to everybody. Pleased to be here with you, and I'm going to be handling the portion of this, as discussed, about what is going on with OSHA relative to COVID-19, and specifically focusing on some of the construction issues that we have as well. So we'll get right to it. First of all, OSHA does not have a rule that deals with this situation. That's the spoiler here. But they started down this road a number of years ago. And if you recall, back when Ebola was a scare that we had in the US, there was a push for OSHA to do an emergency standard dealing with transmissible diseases of a respiratory nature. and they denied the request for an emergency rule, but they did start down the path to a rule under traditional procedures. And they did a small business regulatory enforcement fairness panel dealing with the small entity representatives, that's what the SERs are, who would be affected by this. And it's more than you think. Obviously now it's pretty much everybody, but back at the time they were focused on the healthcare sector predominantly. And so they drafted a complete rule. They got feedback from the regulated community on it. And then things screeched to a halt at the end of 2016. Obviously, we had a change in administration. And the infectious disease rule, which is what OSHA was calling it, got placed on the long-term rulemaking agenda, which meant that they did not anticipate doing any work on it within the next 12 months. And that is as of the agenda that came out in November of 2019. Well, things have changed abruptly, clearly, in that period since then. And most recently, earlier this month, the U.S. House of Representatives Committee on Education and Labor, Education and the Workforce, it's been called back and forth, they called for an emergency standard in the wake of COVID-19. They sent a letter to the head of the Department of Labor, that's Secretary Jean Scalia, and did not get a response on that. So they introduced legislation to force OSHA to do an expedited rule on this. And if that does indeed pass, there would be the requirement to go through the rulemaking procedure. There'll be an opportunity for comment. And this could even trigger that 1 in, 2 out executive order, which means that if this is a mega rule, say with over $100 million in economic impact, there would have to be 2 other Department of Labor rules that were eliminated in order to offset the cost. But we're probably not going to see an OSHA rule rushing to the finish line here anytime really soon. So what we're going to focus on here are the tools that OSHA does have in its toolbox for enforcement of good practices, basically, to prevent the spread of infectious diseases in your workplace, not just in healthcare, with their existing standards. In the meantime, OSHA has put out guidance for the regulated community, and this, again, is not limited to the healthcare sector. In fact, they do have some triage in there for high, medium, and low exposure workplaces, so you can try to do some risk assessment yourself. But that guidance is out there. It's being transmitted through a lot of associations and unions, obviously through mechanisms like this. And so knowledge of those work practices is going to be imputed to the employer for legal purposes for enforcement down the road. So let's take a look at what OSHA is doing. First of all, they have not shut down. They are still actively doing inspections. They are responding to whistleblower complaints. So if one of your workers on a construction site feels that you're allowing people who are symptomatic of COVID-19 or who have actually been diagnosed to continue working, and they drop a dime to OSHA, OSHA can come in and investigate that as a hazard complaint. And if workers notify OSHA that they have been retaliated against for reporting that they are ill with COVID-19 and suspect that it is work-related, that is protected activity under Section 11C of the OSHA Act. And also under the more recently codified 29 CFR Part 1904.36, which is the part of the new electronic record-keeping rule from 2016 that offers whistleblower protections to people who report being ill or being injured. We tend to think of it as injury related, but this does cover occupational illnesses as well. And so under Section 11C of the OSHA Act, a worker has 30 days to notify OSHA that they've been retaliated against for this protected activity. And if OSHA takes the case, they prosecute it in U.S. District Court and can get punitive and compensatory damages. In fact, last year, a construction company had 2 workers who filed one of these actions. It got litigated, and they were awarded over $1 million in federal court in Pennsylvania. So we're not talking, small potatoes here. Now, if the worker misses that 30-day statute of limitations and feels that they've been retaliated against, either for filing a hazard complaint with OSHA about COVID-19 or for reporting that they themselves feel ill or think that they have contracted it in the workplace, if they notify OSHA about this, they have 180 days, 6 months, to follow up, do an investigation, and issue citations against the employer. So now we're not talking about that U.S. District Court route. What we're talking about is a citation that can be up to $134,937 per affected worker. And as part of a negotiation, OSHA could also order you to have compensation for that worker who was affected. So, leaving aside the employment law aspects under the Americans with Disabilities Act, please be aware that OSHA does have some power here aside from the citations under their applicable standards where they can cite you. And that also includes drug testing workers to try to discourage reporting of injuries or illnesses in the workplace. So take a look at where OSHA has been targeting their actions. Certainly, they're advising employers that they could be at heightened risk if they are working in the healthcare sector. Okay, fair enough. And that includes emergency response. I'll just note that while most construction companies don't have their own medical facilities the way some industrial operations do on site, a lot of construction workers do volunteer as firefighters or EMTs, and so they could be affected by this exposure in those second jobs, we'll call it, whether they're compensated or not. And that is a source of exposure back into the construction workforce. Just it is what it is. OSHA also includes death care, kind of a euphemism there, but that includes your undertakers, your funeral homes, your mortuaries, the people who do embalming. It can also deal with the transportation of corpses and crematoriums, things of that nature. Laboratories are covered. Not typically, laboratories that would be, say, analyzing materials for pavement, but rather laboratories that are analyzing biological specimens. Anything in the travel sector, clearly, airlines, cruises, public transit would be affected. Border protection, and that includes really any security jobs because they are the first layer of defense. Very often they are doing screenings. And I'll note that even at airports, there have been several TSA agents who have now come forward as positive. Many people in law enforcement are testing positive. And if you use security forces, and I use that loosely, not in terms of, armed security squads, but if you have security agents who do maintain security at your construction sites, they may have other employment responsibilities that could indeed put them at a higher risk for COVID-19. These are just all things that are moving parts as part of your own risk assessment for individualized sites. Solid waste and wastewater, that can affect the construction sites in terms of your porta potties because there is evidence that this can be transmitted through fecal material. And then, of course, business travel, but most of that has been curtailed anyway. So taking a look at what OSHA does have in their toolbox currently, the big one is the general duty clause, and I'm going to talk about that in the next few slides here as well. That is the gap filler. It's Section 5A1 of the OSHA Act, and it's what OSHA can utilize where there is a recognized hazard that the employer should know about. They have people exposed to the hazard, and there are feasible methods for abatement. Those are really the elements of it. And if they can make that case, and OSHA, of course, has the burden of proving all those elements, then they can issue a citation. It can be repeat, it can be willful, so it has all the same consequences as a codified standard violation. And they can cite you per exposed worker as well. But you do have to have your own employees exposed under the general duty clause. So if you're a GC and you don't have a physical presence on site at the particular moment, and only people employed by subcontractors are exposed to the hazard, that is the general duty clause is the one exception to OSHA's multi-employer citation policy. your own worker has to be exposed. Or in the zone of danger, at least theoretically. Now, the other standards that OSHA is likely to utilize in the construction or general industry environment, for those of you who might have ready-mix operations, for example, or precast, the first one is 1910.132, and that is your overarching general personal protective equipment, PPE requirement. You have to do a risk assessment. It has to be in writing for each task that you have and identify what PPE is required. This includes both respiratory protection and also things like work gloves, steel-toed boots, hard hats, safety goggles, and earplugs. Now, if questioned by OSHA as to how you determined which PPE was required, you're going to have to be able to articulate that to them. And one of the trap doors in this that I've encountered from clients who've questioned me about COVID-19 is, can we just mandate that everybody wear an N95 mask, regardless of whether it's needed for silica or for other reasons? And the short answer is, you can mandate that, but then you're going to need to include that in your written hazard assessment. And you, the employer, are going to have to articulate to OSHA why you determined that an N95A was needed. So that means that you're inferring there is a risk of COVID-19 transmission in your workplace. And then B, how you determined that an N95 mask is going to be adequately protective of your workers. And if you're mandating the use, and you haven't already done this for purposes of silica, under Table 1 of that rule, then you're going to have to go through the medical evaluation and the fit testing for your workers. OSHA has made a carve out recently for the N95 masks, saying that they will want you just to do quantitative testing rather than qualitative testing, because they don't want to destroy the masks in the testing process for fit testing. They've also waived the annual fit testing as long as initial fit testing has been done. However, at present, those are limited to the healthcare sectors. So in terms of construction use, you're still going to have to go through the full panoply of testing and medical evaluations, et cetera. But once you mandate this use, again, if it turns out that somebody gets COVID-19 on your watch and the N95 turns out not to have been used properly or was not adequately protective, you could have some exposure liability there from a workers' comp as well as potentially from an OSHA perspective. Now, beyond that, there's eye protection requirements and face protection. Again, COVID-19, they're recommending wearing safety goggles to prevent transmission. So that's something you need to consider. If you don't normally wear those on the job, for what tasks might you need to wear those to address COVID-19 transmission? We get into the big enchilada, which is the 1910.134 respiratory protection rule. There's an awful lot to that, and we'll go through that real briefly in a minute or two here. The sanitation standards apply to the porta potties, and also having warm running water and soap, adequate paper towels to dry with, trash dispensers for those as well as for Kleenex on the site. The medical records access rule, that has implications not only for medical surveillance, but also medical evaluation and fit testing document retention requirements. Bloodborne pathogens, it's on there, but typically you don't need to worry about that in the construction environment. There are some general industry facilities, though, that would be subject to that as well. And then you've got the HAZCOM standard. If you have workers who are doing cleanup repeatedly now with bleach or other chemical solutions that are being used differently than the way a homeowner would use them, that is going to cross the line from commercial use that typically is not covered and is exempted, in fact, under the HAZCOM standard, to requiring training on the safety data sheets and the utilization of the proper gloves, for example, and that is triggered as well under 1910.138. And then finally, as I mentioned, there's the record keeping, injury and illness reporting requirements. if somebody does tell you they got COVID-19 on your watch and you have reason to believe there was work-related potential exposure, that has to go on your OSHA logs. If the person is hospitalized, you have to notify OSHA within 24 hours. If they passed away, you have to notify OSHA within 8 hours. And some state plans have more stringent requirements. If you miss that reporting requirement, it is a mandatory minimum penalty of over $5,000. So that's an expensive mistake to make. So general duty clause, I'm not going to belabor this. This just captured what I told you already. And how do they impute knowledge to the employer? First of all, employer recognition can come through your own materials, your own memos, emails, policies. So if you've adopted policies on COVID-19, that itself is acknowledgement that you had a potential, or at least a recognition that this was a risk in your workplace. Other ways are through industry recognition, such as this roundtable. And then there's common sense recognition. And at this point, you'd really have to be a mole person not to know that COVID-19 is a risk out there in the world. So any of these ways are routes toward establishing that recognized hazard, which is the springboard for a general duty clause citation. I just want to mention briefly, for those of you out in California, that Cal OSHA got ahead of federal OSHA on this, and several years ago they adopted an ATD standard, aerosol transmissible disease rule, and they also have put out guidance on COVID-19, and I've given you the link there, which needs to be incorporated into your programs, including the mandated injury and illness prevention program that Cal OSHA has for all employers, including those in construction and even in mining, because they have dual jurisdiction with MSHA. The basic requirements of this are very similar to what OSHA had in its draft rule. And what's notable here really is that in addition to covering your health care and death care and laboratories, correctional facilities, et cetera, they put in a little weasel out for them, which is any other locations when Cal OSHA informs employers in writing that they must comply with the aerosol transmissible disease standard. So if they make a decision, if the governor of California decides that this is spreading through construction sites and they send out a letter to all construction employers in the state, then you too would have to comply with this standard. And these are the elements of it. Again, given the time limitations we have here, I'm not going to go through each of those, but they're pretty self-explanatory, and those should be active links. I've mentioned the whistleblower protections already at the outset. What about coworkers of the sick employee? We've established the sick employee has protections under Section 11C and under the whistleblower provisions of Part 1904. Those who are coworkers similarly have the right to call OSHA if they believe that they are being exposed to a hazard in the workplace. So don't forget the well may have some whistleblower rights there. And then finally, under the ADA, really in establishing how you're going to respond to this, my recommendation is go through the direct threat to safety analysis that is the affirmative defense under the Americans with Disabilities Act. You have to base it on objective, scientific or medical evidence that is individualized to your work scenario and that worker, and then determine whether you can reasonably accommodate their time in recovery from COVID-19, telework or otherwise. And if you determine that they or other workers would be at risk, then you have the right not to bring them into the workplace. So that's a very thumbnail analysis on that. On drug testing, very quickly, this ties in with that whistleblower protection under Part 1904. And while OSHA has no issues with random drug testing, reasonable suspicion, doing testing pursuant to a workers' comp or DOT requirements, if those exceptions don't apply and somebody reports being ill or injured, OSHA says you can only do that drug testing if it is part of a root cause investigation. And then you have to test not only the worker who reports being ill or injured, but also any other employees whose conduct or activities could have contributed to the situation. And of course, you need to document that in an actual root cause investigation report. Now, if you have somebody who says, I think I got COVID on your watch, and you immediately send them for drug testing, hoping that they will tripwire, a positive test for cannabis or something, and give you an excuse to fire them, that is retaliatory, because clearly impairment is not a cause of getting COVID-19. And so you'll want to look at your individualized state laws as well, protecting medical cannabis users, because they may come into play here. But just be aware, don't use drug testing as a club to discourage people from coming forward and reporting injuries or illnesses. At this point, I've just captured for you on these slides the individual standard requirements I already went through on the PPE requirements. I will note that if you're allowing people to voluntarily use the N95 dust masks for their own comfort or maybe out of their own paranoia, that's fine, but you need to post Appendix D, like in dog, to 1910.134, which is the respiratory standard. The best practice, I believe, is to have your workers sign an acknowledgement, so you have a receipt that they are using this voluntarily, not under mandate. And that way, if they have a beard or more than a day's worth of manly stubble, you're not going to get cited by OSHA, because otherwise you got to be clean shaven. 1 day max stubble is what OSHA allows for the mandated use of those dust masks. Workers' comp, as I've said, the employer ultimately makes the decision whether to put it on the log or to notify OSHA, based upon whether you believe it is work-related, there is a confirmed case, not speculative, and if it meets the recording requirements. So medical treatment more than first aid, days away from work or restricted duty. Obviously, a fatality would fall in there as well. And then in terms of workers' comp liability, that is going to be pretty much a state-by-state determination, but there is no requirement that something be compensable under workers' comp to be reportable or recordable under OSHA Part 1904. And then finally, the Mine Safety and Health Administration. Many construction companies do work at these operations, cement plants, stone quarries, sand and gravel pits. You may not even realize that you're under a different agency, but you are. MSHA, first of all, they kind of punted back to the CDC and OSHA guidelines. They have put out guidance, though, saying they're going to continue their essential inspection functions. They have mandated inspections twice a year surface, 4 times a year underground at all mines, and that includes all contractors that might be on site. These have been deemed essential activities or businesses in pretty much all the states that have put any lockdowns, so they will continue operating. The inspectors are going to keep their distance from the miners or contractors they speak to. They're probably not going to be doing the health sampling, because that involves getting too close to hang pumps. But they are giving you a little bit of leeway. If you were due for annual refresher training under either MSHA Part 46 or Part 48, and it was due, say, in March or in April, notify your local office and they will give you a 30-day extension or possibly longer. Same thing if you're doing work at coal mines and you have certifications that are coming due. They're going to give extension, but you have to notify them. You can't just blow it off. And for new miner training, which is the prerequisite to legally start doing work at a mine site, there are no extensions. So if you did the 4 hours for Part 46 up front, thinking you were going to finish the rest of it within 90 days, and now you can't get back on site, you're not getting an extension. You're going to have to start all over again. So at that point now, I am going to turn the proceedings over to Herb to take us away with the rest of the proceedings here, and then we'll take your questions.
Thanks so much, Adele. Great job. Boy, that's a lot for us to absorb. Good morning, everyone. When Kurt contacted me a couple weeks ago about doing this webinar, I immediately thought of the phrase, you don't always need to know the answer, you just need to know where or who to go to. And I thought of our staff's certified industrial hygienist, Kevin McMahon, who's going to take over here in just a minute. And I thought, who better to talk about this than Kevin, because he's actually been part of writing plans for the H1N1 virus years back. He's also currently written and authored some COVID-19 plans. And I thought Kevin would be great to do this morning for our company and to be a part of Kurt. Just a couple quick nuggets. We may not have it all together, but together we have it all. And then one other thing from Henry Ford: when everything seems to be against us, remember that the airplane takes off against the wind and not with it. So hang in there. We're all going to get through this together. And I appreciate Greg and Kurt for having me to be a part of this. At this time, I want to introduce Kevin McMahon, who will take over the rest of the presentation. Kevin is a certified industrial hygienist. He is Director of Technical Services with Hastech, with over 40 years of experience in occupational health and safety. Kevin, thanks for participating, and it's all yours.
Thanks, Herb, and good morning to all. So as safety leaders, we recognize, we evaluate, and control hazards in our workplace. So if you're working at a leading edge, you recognize a fall hazard. You evaluate it and control it. Use guardrails, work zone monitoring, training, personal fall arrest systems. Well, now we have a new hazard in the workplace, COVID-19. And we need to act quickly, decisively, sometimes creatively, to control the spread and to protect our employees. As Adele mentioned, OSHA has published a guidance document recently on preparing for COVID-19 responses. In this document, OSHA recommends a number of measures. Develop a plan, implement basic prevention measures, develop policies and procedures so that you can identify who may be at risk of infecting other people. Develop and implement a communication plan and ways in which employees can use flexible work arrangements to protect themselves. And finally, of course, implementing the workplace controls, what I call operationalizing the plan. So evaluation of the hazard tells us that the spreading of the virus occurs through close, and that would really be sustained, but not just incidental contact with an infected person. That person could be symptomatic or asymptomatic, but they're probably infectious a couple of days before the first showing of symptoms, and that's what kind of complicates some of the matters here. And then, of course, through contact with contaminated surfaces and then transferring it to the eyes, nose, and mouth. So to effectively control the hazard, we have to keep employees apart through social distancing and performing hand washing and disinfecting of surfaces. Basic infection preventive measures are well known to us now. Hand washing with soap or alcohol-based sanitizer, keeping employees at home when sick, covering coughs or sneezes, flexible work practices, avoiding sharing of equipment, tools, and other objects, and cleaning and disinfecting. OSHA doesn't explicitly say you must have a written plan, but it is highly recommended. And of course, as you probably know, many are required by owners and GCs to have and submit those plans and have them possibly approved. Most importantly, again, operationalize it. So have a plan coordinator or an event management coordinator to oversee the plan. It's important to assign specific roles to site personnel that will be implementing the plan so everybody knows their part and everybody carries it out. And of course, train and retrain employees on the plan. As mentioned, social distancing is a primary means for controlling the hazard. And fortunately, there are many options for social distancing, but it also helps to get a little creative. So keep to one-on-one or small meetings, depending on the size of the room. Hold meetings outdoors, for instance, your toolbox talks. Hold meetings in larger rooms so that you can accommodate that distancing. Limit the interactions in the number of employees in any one work area. Avoid multiple workers in elevators. Use stairs. Don't stack the trades. Stagger the shifts to reduce the density. Possibly have a 4-day work week, which allows you to, again, spread things out, have less commuting, less interaction. Use phones for communicating, voice, text, emails. Hold virtual meetings or telecommute. Avoid pool vehicles That's an area where it may be difficult. You don't want to overcrowd in a vehicle. Jobs with multiple man lifts, you can designate for one material and the other for personnel. Limit non-essential travel. Consolidate your supply runs. Have employees bring lunch so they don't have to go out. Again, avoid as much interaction as possible. And of course, keeping employees who are sick or may have come into contact with other infected or possibly infected persons is the most important form of social distancing. The second method for protecting employees is disinfecting, and that includes hand washing and sanitizing. As we know, availability of commercially prepared solutions like Purell are very limited, if available at all. But regular soap and water, when used properly, is very effective for hand washing. Clean and disinfect items that have to be shared, equipment, tools, vehicles. And for cleaning and disinfecting, you can prepare homemade disinfecting solutions following CDC guidelines. And I'll talk a little bit more about that a little bit later. When you're doing disinfecting large surfaces, you may need PPE, such as gloves, possibly a respirator. Some of these chemicals can be dangerous if inhaled, and coveralls when, again, disinfecting large surfaces, or also if you're doing temperature scanning, which I'll mention later. Temperature screening. This is becoming more common as a way to identify at-risk workers. But it's not necessarily a simple procedure, and to be effective, it should follow CDC guidelines and should be done by trained personnel. So if you're going to do temperature screening, consider who's going to do it, what you're going to do, where you're going to do it, when you're going to do it, and how you're going to do it. And again, make sure that you're following accepted practices to be effective with it. You may need to consult your HR department, determine if there's any impact to HIPAA. You should give a person an opportunity to opt out, but if the person opts out, then there's no work. The types of temperature reading devices. You should only be using non-contact thermal scanning, the type that you use to take temperature at the forehead, devices, or infrared type devices. Question becomes how many? How many will you need? This process can take time, and if you have a large site, getting a lot of people through this process may take considerable amount of time. What guidelines are you going to use from a temperature standpoint? How elevated does it have to be before you prevent access from somebody? How long would that person need to be removed if they did have a temperature? And of course, anybody that's performing the scanning should have the proper PPE, masks, gloves, eye protection. And of course, before instituting this program, make sure it's communicated to everybody and make sure people are properly trained about it. We can successfully operationalize the plan by doing certain things. Audit your plan. Make sure it's being implemented as you intended it to. Take corrective actions when they're needed. Document your audits. Know your state's jurisdictions requirements for containing the virus. And this is changing almost on a daily basis. So stay informed. Perform daily updates and toolbox talks for employees as reminders and updates. And if the job site has to be shut down, make sure it's conducted in an orderly manner. Continue to review your plan often, update it as it's needed based on any new and changing information. Let's just quickly review cleaning and disinfecting. So if you can't obtain a commercial solution, you can make up your own, and it's pretty simple. 5 tablespoons, about a third of a cup of bleach per gallon of water, or 4 teaspoons of bleach in a quart of water. Follow the manufacturer's directions as always, and make sure that you never mix cleaners and disinfectants. It's well known that mixing chlorine products with ammonia products could result in very significant toxic gases being produced. You can let the solution dry, air dry on the object that you're disinfecting to give it enough contact time before you do any rinsing of it. Let's talk about face masks, all right? Was mentioned earlier by Adele. Okay, this has become one of the more questioned practices. We see a lot of this on the news. We saw it widely used in China. So what's recommended? Well, as of today, CDC only recommends face masks if you're sick or caring for somebody who's sick. I can tell you though, as I'm watching the news and I'm watching some very respectable doctors, I think we're starting to reconsider a little bit about this practice, but with certain and very important qualifications. First, as before, N95 should still be reserved for healthcare workers. We've all seen the situation in hospitals, and it's extremely important for those first-line responders to be adequately protected. Second, dust and surgical masks can be used to prevent an infected person or suspected person who might be infected from spreading droplets containing the virus, and can also help non-infected persons from touching their nose and their mouth, which of course is a way to transmit it. I think we're going to see more on this in the days to come. With that, let's review the different styles of masks and respirators and how useful they can be. All right, so regular dust masks, the type that are used for non-hazardous particles, for instance, wood dust. These are standard paper filters for everyday use, but they will not protect you against COVID-19. Surgical masks. Again, these are for people who are sick and healthcare workers. And interestingly, I did some reading on this. Originally, they were designed for surgeons to protect the surgery field, not to protect the surgeon. And they provide very limited protection against COVID-19. The face mask's main purpose is to keep out the liquid of an infected person's sneeze or cough from entering your mouth or nose. A little bit gross, but that's what it's meant to do. Face masks can also help prevent hand-to-mouth viral transmissions because you can't directly touch your own mouth while you're wearing one. Viruses, however, can be transmitted through your nose or eyes, and virologists say that surgical face masks cannot block airborne viruses from entering the body. So they're of limited use. We know that the standard is becoming the N95. So let's quickly review that. So particulate respirators, and these are considered tight-fitting respirators that can give you a good face to mask sealing. They're designated in 2 ways, by resistance to particles and their efficiency. And so you'll see that there are actually 3 different letter designations, N, R, and P. The letters stand for, again, what they are resistant to. So an N means it's not for situations where the droplets or aerosols or particulates are oil-based. An R mask or respirator is for oil, means for oil resistant. That means it has some resistance to particles that are based in oil. And then a P is for oil proof. And that's why you typically see N referred to. But these other types of respirators can also be used. We're just not hearing about them, and they're probably not as available and maybe more expensive. Of course, Your dual cartridge air purifying respirators with HEPA filters, powered air purifying respirators with HEPA filters are also going to be good. So now, to summarize the key points here, maintain social distancing, assure that soap and water and or hand sanitizers are available at the bathrooms and generally around the work site. Avoid sharing tools and equipment or utilize EPA-approved disinfectants on those equipment and tools or other objects that will be shared among site personnel. Instruct workers to stay home if they're showing signs of illness. Again, fever, cough, shortness of breath are what is typically involved. And as needed, develop a site screening process involving self-certification and temperature screening. And so with that, I'd like to turn it back for any questions that the audience has.
Great. Thank you so much. This has been one of the most informative presentations I think I've seen in terms of content. For those who may have joined late, be advised that a couple of things are going to happen. You will have full access to the screen or to the slide set in an email that will follow later today. You'll have access to the recording if you're a CURT member. You'll also have access to the contact information from both Adele and Herb and Kevin. I'd like to begin the Q&A at this point, and I've got one that came in on text. So if an office is informed that one of the office employees may have been in contact with a COVID-19 patient from somebody at their household, do I have a duty, responsibility to disclose that to the other employees? And what about HIPAA and HERPA laws? How do I avoid breaking the law for a public disclosure of a private fact? I think that might be Adele's, maybe Kevin's. You folks weigh in if you would, please.
Sure, I'll jump in on that. The short answer is that there is nothing about the emergency nature of COVID-19 that waives the employer's obligations to comply with HIPAA. So you have to keep the identity of any individual who either is suspected of having COVID-19, actually tests positive, or is at elevated risk private from other employees. Having said that, if somebody has an actual exposure in the workplace or there's believed to be an exposure, there is a responsibility to let your workers know that so that they can in turn take precautions, perhaps get themselves tested and ensure the safety of their families. So it is very much a knife's edge that you have to walk from an HR perspective. Ironically, a good friend of mine was just in this situation where she was told that an office where she did work as a subcontractor had somebody who was suspected positive, and she was on tenterhooks because of not having a direct relationship. And this is very much like what we deal with in the construction field, where you might have a sub whose worker is suspected as positive, and now you've got other trades that may have had exposure as well. This is part of your planning, as Kevin was talking about, is how you're going to do these emergency communications, but do it in a way that it is going to only disclose the information you legally can share. And my recommendation is we get very much wrapped around the axle right now about COVID-19. You know, I don't think we're overly hysterical because this is a huge deal for sure. But think about how you would handle it if someone was exposed to measles in your workplace. You know, you would still want to share that same information with your workers so they could take appropriate protective actions.
Does one need to get permission from the employee who disclosed the situation first before taking action, or can the employer take that action irrespective of the one who reported it?
In my view, at this point, the employee who is sick or suspects having been exposed would not have any kind of veto power over the employer satisfying their responsibility. And I mean, when you come right down to it, there is a public policy argument, I think, that could be raised here if any invasion of privacy claims were to be brought. Now, if you identified the individual by name or engaged in any kind of retaliatory action, that could be problematic. And, not to dominate this, but I'll close in saying, please, everybody, look at your individual state emergency declarations, because some of them, Pennsylvania, for example, one of the states where I practice employment law, they have embedded protections there, not only for COVID-19 positive people, but also for those who have to self-quarantine because of exposure. Mm-hmm. And so you don't want to tripwire a state law on your way to thinking that you're complying with some other law.
Great, Adele. Thank you for that. One of the questions being asked is they're getting reports from the construction workers, this person asked, that are concerned about having to go for drug tests and as a result being exposed to COVID-19 at the lab or whatnot. How do we manage that? How should the employer respond, Adele or Kevin?
Yeah, I will jump in again and then turn it over to Kevin. But one of the things you can use for guidance on this is the DOT, U.S. Department of Transportation. They just last week on March 23rd put out extensive guidance on compliance with their mandated drug and alcohol testing requirements. And in a nutshell, do the testing where you can, do mobile testing if you can to avoid your people having to go to sites. But if it is not feasible and employees are concerned about the potential health risks, then there is flexibility for testing at a later date. You have to go through those protocols, and you cannot, for a new applicant, for example, if it's a pre-employment test, you can't put them in a safety-sensitive DOT position until they have done the test. So you might be able to hire them and assign them to a non-safety sensitive, non-driving position. In my view, the same analysis would go for a construction site. You may have to be more lenient or extend out retesting or random. But if you have an emergency situation, somebody you believe is high, you have a duty under the general duty clause to protect other workers from that and perhaps put them off on either paid or unpaid leave, but you may have to waive that testing requirement due to the exigent circumstances.
I think that was a very interesting question here, and I think Adele answered it very well.
Great, Kevin. Thanks. We have another one that says, was it mentioned, I think, Kevin, this may have come from your slide set. Did you say the general contractor is responsible for the subs and the decision of the subcontractor to work on our jobs in certain circumstances and take this chance of getting sick? And it's on there in the chat. If subcontractor employees do get sick, the general contractor responsible?
Okay, I think Adele actually mentioned this briefly, but we're talking, I think, about the multi-employer worksite rule. But Adele, if you want to come back in on that, I know you mentioned that briefly.
Yes, in terms of what the general contractor's liability would be for subcontractors, again, I'm going to ask everybody to take a deep breath and evaluate how would you address this if it was measles or if it was tuberculosis that you got information about. Clearly, if a subcontractor came to you and said, we've had somebody test positive for TB as part of their silica medical surveillance, and other workers have been exposed to that, you're going to have some obligations there to share. Now, because this is a bit of a unique situation, as I said, under the general duty clause, you can only be cited for that if your own employees have exposure. And so, these are situations where, this is not how to say it like this, it's not such a common hazard like not having a barricade up on an elevator shaft or something where you could hold the GC responsible for that because it's open and obvious. And so I don't think OSHA is going to really be rushing to try to do dual liability for things arising from COVID-19. But relative to your own employees, if you're not doing your due diligence, that is, I think, where you have the most exposure.
Great answer. And by the way, if you're joining us late, or if you joined us somewhere after the instruction was given at the beginning of the webinar, there's a chat box right here below your screen. If you just tap on your screen, it should appear. You can feel free to ask your questions. Moving quickly to another question. Many tasks require 2 or more workers to perform that task, and they don't allow for that 6 feet of separation. Any advice on how to handle that? Any recommended PPE or other measures that we should be aware of so we don't violate what the guideline is?
Well, I'll jump in and then let Kevin handle just very narrowly. Washington State, OSHA has some really good guidance out right now relative to construction. And one of the things they say there is they recognize that short-term contact within 6 feet is not necessarily going to pose a safety risk for individuals. And so you don't have to be, that concerned if you have to 2 people carry a piece of equipment that is, 4 feet long and one is on each end. For a short term, you should be okay on that, but wear gloves. Maybe that's a situation where you might want to put a mask on a short-term basis. But when we say the 6-foot rule, it's not hard and fast in terms of being embedded in an OSHA standard. And so I think OSHA is going to be looking at the totality of the circumstances and the work practices and the training, and not try to play a gotcha game where they see that somebody is, 4 feet 9 inches from the next worker.
Great, thank you. Kevin, did you have a comment on that as well? I thought I heard you try to chime in. Go ahead, please.
Yeah, sure. Adele's answer, I agree with that 100%. From what I've seen of physicians, it's a more of a sustained close contact, not incidental, not short-term. We're not talking about seconds or a very short period of time. If I had to name a period of time, what I've heard is like half an hour. So a very short duration, somebody helping each other out should not present a major risk. But again, if there's a certain amount of discomfort about this, I think one of those types of masks could be good, and it could even be, doesn't have to be necessarily be an N95.
And I'll just add, even OSHA, in giving some guidance, is talking about, do your training outdoors, because that is going to help disperse the particulate. That's the ultimate ventilation control. And if you're going to do toolbox talks, keep it to groups of 10 or fewer. So you might have to repeat it if you have a large crew, but it doesn't say you can't do toolbox talks at all. They just want you to keep the size of the crowd down, and perhaps, again, have social distancing so people are sitting or standing in areas where they have that separation.
Yeah, crowding people into a trailer or an elevator or a confined area is not recommended. But if it's incidental, if it's outside, should not present a major risk.
Great, thanks, gang. One of the questions asked, and I think, Kevin, you dealt with a little bit. Can you expand on the temperature scanning and what happens if they opt out? Do you have a right to lay them off, or you have a right to send them off the job? Comments? Can you clarify a little bit on that? I think it was Kevin.
Sure. Okay, so if you're going to do temperature screening, make sure you follow a recognized protocol. And the CDC has some protocols. If anybody is interested in that, needs more information, please contact me. I'll be happy to give you what we are recommended as the specific protocols for that. If somebody refuses, my recommendation is they can't enter. Can't get into work. They have to go through this process and be evaluated and determined to be safe to come in.
So would that be similar to refusing to take a drug test in the past new normal?
I'm going to pass that one off to Adele.
So when they refuse to take a drug test, is this refusal to take the temperature tantamount to refusal to take a drug test in terms of employability, Adele?
Boy, that is a sticky wicket, and it is different from a drug test in the sense that, drug test, you're trying to capture impairment, which, is kind of a separate thing. We have a lot of case law developing that. This crosses a line and I hate to, always throw a red flag in, religious. If the person's refusal to have their temperature taken or undergo other medical exams is based on religious protections, again, you have to accommodate that under Title VII. So now we're not talking about the ADA. And even OSHA, for example, in its silica guidance, I keep going back to that, on its medical surveillance requirement, if an employee refuses to undergo medical surveillance for silica, OSHA says you cannot force them to do that. So I would say the same analysis could apply here, but go back to what I said earlier about the direct threat to safety defense under the ADA. If you determine that this person is a hazard to themselves or others, and you can't mitigate that hazard because they refuse to have their temperature taken, then I think you're on more solid ground. You just have to document the heck out of it.
Thank you. Now, let me interrupt for just a moment. It is 12 noon. We are on a stop at 12 noon. However, I think because of the importance of the subject, if Kevin and Herb and Adele are willing to continue past the noon hour, we'll entertain some more questions. Are you guys able to take a few more questions?
Yes, I'm fine with that.
Yeah, I'm available too.
Okay, super. So here's the announcement I want to make for those who have to leave us now. Again, at the end of the day, you should receive an email that will contain the biodata sheets for each of these presenters, the contact information for each presenter, the slide decks that you've seen, and for Kurt members, of course, a full recording for you to distribute out. I will tell you if you joined late, welcome. But there's so much good information preceded your joining us if you joined us anytime past 12:15. So this information is available to you as well as pre-registration for the next event and other valuable information. Expect that email by close of business today. That'll give staff a little bit of time to pull that together. So for those of you who must leave us, I want to thank you for joining. To Adele and Kevin and Herb, I want to thank you again for being such a terrific resource to us. But we're going to continue the Q&A for a few minutes longer, simply because of the impact and the importance of this issue on our sites. Somebody asked, is COVID-19 recordable as an illness for a worker who becomes ill while on the website, or excuse me, on the job site, or tests positive for the virus? Adele or Kevin, comment?
Yes, and I did address this very briefly in one of my slides. OSHA's perspective is that if somebody is positive for COVID-19, it is work-related, and it results in medical treatment, which goes beyond first aid. So if they're just taking something over the counter from the pharmacy, and they don't, go do that pursuant to a doctor, then it would not be recordable. But if they actually, have to get antibiotics or some other medical treatment, or they're placed on restricted duty, maybe you make them work from home, that would be considered restricted duty, or they actually have days away from work, then OSHA says, yes, that does go on the log. But again, the work-relatedness, it's interesting in the sense that the symptoms can manifest in the workplace. It doesn't mean that the contagion occurred in the workplace. So then, the employer has to, again, do their due diligence, look at, did they have any other people that were positive to whom this person was exposed? Was the person caring for somebody at home who has already been diagnosed? That would mitigate more toward it being an off-the-job exposure. And, you don't want to claim this if you don't have to. Mm-hmm. But in terms of the recording, that is one thing. It goes on the OSHA log. The bigger issue is if somebody collapses in the workplace and you have to call the ambulance and they are taken away and put in the ICU and intubated. Do you have to notify OSHA under the severe injury reporting rule? And that, I would say, is yes. And this, I know, sounds like a squirrely, but even when someone has a heart attack or a stroke on the job, OSHA expects you to call them, and then they will make the determination on whether it is work-related or not. I had 3 people last year who had people overdose from drugs on the job and were taken away to a hospital, and we still had to notify OSHA. Then once they determined that it was not a work-related chemical exposure or heat stress that made them collapse, they left it alone. Same thing even with attempted suicides in the workplace. OSHA wants to know about those. So it stands to reason that in the midst of this, if somebody does collapse and they're medevaced from your site or taken away in an ambulance, and admitted for for inpatient status, because that's the tripwire, notify OSHA within 24 hours. They're probably not going to investigate it, but if you guess wrong and they find out about it otherwise, it is a mandatory minimum $5,000 fine. And again, for construction companies, that's a pretty expensive mistake.
Yeah, I've had a similar experience in terms of somebody becoming ill at work. Employee actually had a heart attack on the job, and we did report it. Was determined later that it was not work related, but we did report it within the requirements. But so I agree here with Adele on this. Although I will say that if it's in a healthcare setting, if it's a healthcare worker, laboratory worker, somebody known to be exposed directly to the virus, that's obviously a much more clear-cut situation than somebody getting ill on a job site, and then it becomes very difficult to prove it occurred there or didn't occur there.
Right, and if you are a contractor working in a healthcare facility or a nursing home, maybe you're putting a new roof on a portion of the building, that would mitigate in favor of it being potentially a work-related exposure. But I want to note, even though I mentioned the severe injury reporting requirement, you can notify OSHA when the person collapses. And then once the determination is made that it was not work transmitted, you don't have to put that on your log. So, you can run the clock out. You do have the 7 days to make a determination on whether to log it. And even after that, you can go back and amend your logs. So don't carry that on your 300 and 301 logs if you don't need to. And do not equate the three different moving parts. There are different triggers for the reporting to OSHA within that 24 hours, the recording on the log within 7 days, and whether or not it is compensable under your state workers' comp scheme. Three different legal analyses.
Terrific. Thanks, gang. And for those who joined us late, we are extending past the noon hour because of the importance of this issue and the severity of non-compliance or non-adherence to some of this great advice. And we'll take as many questions as we can. For those who joined us late, the chat box is right below. So if you tap on your screen, you should see the chat box come up. Press on the chat box, ask your questions. We'll get to many of them as possible in the next several minutes. So another question, can the voluntary use of N95 masks be acknowledged as a part of the self-certification process? And what should the self-certification include? Kevin or Adele?
Well, it's kind of a mixed question there. So I understand. What I understand the question to mean is if you have a self-certification process, a questionnaire which attempts to identify somebody who is at risk of spreading the virus, can you add a voluntary use of N95 to that? So I think there's two different issues here, two different questions here. Certainly, voluntary use of N95, as Adele mentioned, is possible in this situation, but you have to inform the employee of Appendix D. So I think it's somewhat of two different issues here, but Adele, if you have anything to add, if I'm missing something here.
No, I read the question the same as you do. And again, the litmus test that employers have to be crystal clear about is this voluntary use? Is this for comfort? Is it for their own peace of mind? In which case, whether they're clean shaven or not, you can let them wear it. Just have that acknowledgement signed, in my view, of the receipt of Appendix D. And of course, make sure you have it in Spanish as well as English if you have workers who don't read English. But if you are mandating the use, then that is where you have the whole panoply of things under 1910.134 kick in. And so, you really have to figure out, why are they wearing this voluntarily? And if you believe that someone is positive, in my view, it is very irresponsible as an employer to say, okay, dude, put this N95 on and go have at it and work with your coworkers, because they're going to be taking that thing off when they talk to their buddies. They're going to take it off to have a cigarette or, chew tobacco. I mean, we all live in the real world. And when it's a voluntary use of these masks, they are not treating them with the same care as they do under mandated use circumstances. And so allowing somebody who you think might be positive to wear one voluntarily to protect other workers, it isn't going to work, and it's going to blow back on you, in my view, in terms of liability.
Yeah, if that was the intent of the question there, to in lieu of filling out a questionnaire or answering a questionnaire and having it become positive, so to speak, on the questionnaire, and then to use an N95 as an alternative, I totally agree with Adele on that. That should not be permitted.
Great, thanks. And for those who are joining us late, we're extending this to 12:30. We will indeed have a hard stop at 12:30 because we have other obligations. Our staff does, you folks do, our presenters do. So we want to make sure that we go no later. Continuing quickly for their questions, can owners require the contractor to disinfect the job sites? Are contractors doing it voluntarily? And any cost-effective means to do it other than just wiping down surfaces? Kevin, you want to field that one first?
Well, I think we have some contract issues here, I guess, at very least here. I suppose that a contractor, subcontractor can request that to be part of the contract, and as such can agree or disagree with that. Of course, there's a variety of scenarios that may happen as a result of that, but I think I would view this as a contract issue, and work it out from a contract standpoint. And that gets obviously involved in legal issues here. So I'm also going to see if Adele wants to respond.
Sure, I'll tackle this a little bit. First of all, this is a really, to me, scary legal issue, because if you say as the GC or the owner of the project delegate to a sub who is normally doing trenching work to disinfect your area, you haven't pre-qualified them. You haven't really considered whether they have the expertise in this area. And I realize we're all flying by the seat of our pants here. Within their own company, certainly every contractor and subcontractor on a site should have their own protocols, like what Kevin already addressed, on how they are going to tackle disinfection of tools and equipment that might be shared, and doing your own risk assessment for your own work area. But once to turn it around, say you are the plumbing contractor and you're told that you're going to be disinfecting things. How are you going to be ensured that you're doing an adequate job of that? And if somebody else from a different trade gets sick, now do you have that liability? If you are the GC and you delegate to each sub to undertake, a more generalized cleaning, how did you select them? How are you going to defend your contractor utilization? So I'm almost thinking, at least in terms of a general work site cleaning, this may be where you bring the pros in, and maybe you do a separate contract for somebody to come in who has expertise in this area, and then allow enough time, as some of the suggestions have been with OSHA and CDC, stop one shift a little bit early, start the next one a little bit late so somebody can come in professionally and decontaminate the shared areas. That is one approach that I would recommend. And then beyond that, each sub should, as best practices, be disinfecting their own tools and equipment, the things that they exercise unique dominion over.
Yeah, the CDC has guidelines on disinfecting and sanitizing, so I would refer folks to that if they want more information. Or again, I'd be happy to provide some of the information that we're providing to our clients in terms of cleaning and disinfecting.
Great. The next question I hear is a scenario, and the scenario goes something like this. A construction site has had 2 independent and staggered cases of workers testing positive COVID-19. The construction manager then disinfected immediate work areas where those workers were located. Whether or not that's up to standard or not, we discussed a minute ago. But that person, the CM, has not issued a formal plan or protocol to subs or others who may be on the job site. When you're being asked to commission a life safety system without a formal protocol for such, how can that person do that and help the others stay safe. Let's stop on that point. Asked to commission a life safety system on this pandemic, this COVID-19, without a formal protocol, what are the natural steps you would take in that scenario?
So we're referring to disinfecting here?
Yes.
Cleaning and disinfecting, it sounds
Yes.
like. That's the
Yes,
question.
correct.
Again, I would follow CDC guidelines in terms of how to properly perform that. And so there should be a formal protocol developed and followed for that types of disinfecting. But I will add that it sounds like they're referring to, there's a couple of cases of positive people on a job site. I think that was part of it, the question.
Yes, sorry. Yes.
Well, of course, disinfecting, may help to some degree, but you have to consider how else it can be spread, and it could be spread through close contact. So just disinfecting alone isn't necessarily going to avoid the spread. It may have already happened.
Adele, want to weigh on it at all?
Yeah, I mean, I agree with what Kevin was saying, and the fact that there were staggered 2 cases of people testing positive. One of the things I would want to know is, how did they address that? Are those people off the work site totally? Did the people that they interfaced with within that individual subcontractor unit, have they in turn been tested? Are they positive? Are they off the work site in self-quarantine, or are they back on the work site? So those are some of the moving parts in terms of the risk assessment. And without, I agree, without some kind of formal protocol, you are shooting rubber bands in the dark and hoping that you're going to hit the right target, legally speaking. The construction manager, in general, is going to have some legal exposure for ensuring the safety of everybody on that job site, in part because they may be the deep pockets on the job. And so, don't skimp in spending the time, the money, get outside resources if you need it to develop a good plan. Train on the plan, because if you have a plan in a bright, shiny binder and it's sitting on the desk in the trailer, that isn't doing anybody any good. Make this the topic of your, pre-work huddle, and explain what everybody is expected to do. If you have to pay extra, and put change orders in, because people are now going to have to be spending more time disinfecting between things, so be it. It is the life, we're in the new world now. But as the construction manager, you can't just put blinders on, hire, your low bid subcontractors and say, keep everybody safe, y'all, and think that you have satisfied your obligations. You have not.
I think, Adele, this may give rise to a new reasonable person test. How much is enough? Where do I draw the line? What's the marginal utility of the next step? And since there is no protocol, this sounds like it's new legal territory.
It is a new legal territory, but I would suggest that if you already have an effective safety and health management program, maybe you're under IIPP in California, maybe you've done this proactively under the ANSI A10.33 standard or ANSI Z10. Communicable diseases are part and parcel of addressing occupational health on any job site. And again, we're getting really up in our heads about COVID-19, but we have other communicable diseases that we deal with every single day. And so your plans, your emergency response plans, your safety and health management programs, there should already be a formal protocol for addressing infectious diseases in the workplace. And if you have that, you're just plugging COVID-19 in, and then you have your formal protocol. And if you have never considered the fact that people could get sick from each other on the job before, then I would suggest you're at the very beginning of your whole risk assessment process, and it's time to really step up your game.
Yeah, I agree with Adele, and that's why you want to have a written plan. You want to operationalize it. You want to document that you have operationalized it effectively. This is the same thing as any other hazard on the job site. It's new. This is a new territory to us. We're learning about what to do, and we're gaining knowledge about it. But we have to look at it as it's another hazard, and we have to recognize it, evaluate it, control it, have our plans, implement the plans, and document how well we implemented it. I think that's going to protect you.
Thank you. I did have one come in on text, if I may. What resources are each of you tracking daily? And what resources could we as CURT owner members track daily in order to get up to the minute developments and resources on safety issues relative to COVID-19? So what kind of websites, who are you following daily, hourly? And what do you suggest we as CURT members follow as
what
well?
I'm seeing is that there's a lot of great kind of FAQs coming out or guidance documents coming out. Many of the construction, building trades, state departments of labor and health are coming out. There's just a flood of that information on there, as well as, of course, the CDC. You know, keep in touch with what the CDC is finding and recommending, what OSHA is recommending on their website. And I try not to watch the news too much, but some of it is important to stay up to date on what's going on. And there's just some great advice coming from very respectable physicians in this area and epidemiologists, and great stuff on YouTube. I've watched some really good presentations from some, again, very respected doctors.
Great. Kevin, if you and Herb could pull some of those together, we'd be glad to put them into our daily wrap-up that'll come out following this. Adele, any comments on what are you tracking?
Yes.
And what should we be tracking?
Well, in addition to the resources that were mentioned, and obviously OSHA, MSHA, NIOSH, which is National Institute for Occupational Safety and Health, a subset of CDC. CDC has a lot of things out for the public health and safety. And then NIOSH, you're kind of targeting down toward workforce protections. Remember, there are 22 states that run their own OSHA programs.
Mm-hmm.
Every one of them has information now out there. Like I said, WSHA, which is the Washington state, had this. They were the first out of the gate that I saw that had something unique to construction. Cal OSHA, they have their own standards. So that is really something you can look to for guidance, because it is something that a lot of employers in California have already worked up. So there are resources out there. Beyond that, American Society of Safety Professionals, the National Safety Council. I'm very active with both of those groups, and I know we've been developing a lot of material. There are free webinars that are being put out there that come at this angle, this topic from different angles, so you can look at those as well. And then, especially putting my lawyer cap back on, if you have operations, as some of my construction clients do, maybe in 10 different states, you really need to read those emergency declarations from each one. Some of them, construction is not considered an essential service, and you can literally be in violation of the law if you are continuing operations. Some of them are exempting out certain specialty trades like electrical and plumbing, but not, general residential construction. And then, as I mentioned earlier, you have to look at unique provisions that might impose burdens on employers in terms of paying employees who are off from work, or the anti-retaliation provisions, like I mentioned in the Pennsylvania law. So these are being updated, just like all of these other things are, almost every nanosecond. And so you really do have to maybe task somebody within your company that can, read this kind of jargon and understand what it means, and have them, capturing the things that are applicable to your organization, and then doing an update for management, on a daily basis, or at least every few days, because things are changing in real time here.
Thanks, Adele. And if you wouldn't mind also to give 2 or 3 or 4 of those, Greg Palmer, one of our producers for these events, is listening in at a remote area. And Greg, if you'll take note to reach out to Herb and Kevin on their end for some of the YouTubes or websites or whatnot, and do the same with Adele, then we'll include those in the daily follow-up that you'll get later today. Also, keep in mind we're recording this. You'll get the entire slide set. You'll get the recording if you've registered, attended this thing, and you can send that out internally to your organization. I'm going to begin to wind down now because I think we're out of time. We want to respect the time of our presenters. First of all, I want to thank Herb and Kevin and Adele for just an amazing job, a very informative 85 minutes. Thank you so much. You are truly great Americans and great members of the construction industry. We're so grateful for your time. Thank you so much. We want to recognize that. Second, you may have seen in the pre-webinar scroll that we have come up with a construction and crisis special report. This is a one-page email that'll go out once a week that just assembles resources that we're garnering from these webinars as well as others that owners make us aware of, and putting those out into a weekly email. If you want to subscribe to that, call Greg Palmer or Kyle Costco here at the office, or email Rob or Rana. They'll have a link to how you can subscribe. And the reason for the extra click of a button, if you will, we don't want to inundate you with just lots of announcements about what we have. We want you to pull what we've got on the smorgasbord, if you will. So make note of that. Also, I want to tell you that Thursday, this coming Thursday at 11 o'clock, an outstanding presentation brought to you by some folks from Merck, some folks from SABIC, Saudi Arabian Oil Company, SABIC organization, on planning during a pandemic. In the heat of the battle, how do you plan readiness to stop work? What are the essential elements you need to be aware of as you shut projects down or put a moratorium on them? So that's this Thursday at 11 o'clock. You'll have some registration information in the follow-up email. And then the following Tuesday, we will have a leveraging lean during COVID-19. Cynthia Sau will be with us, an outstanding lean academician and consultant. And what do we do with lean? How does lean play during our COVID-19 crisis and continuing the essential business of construction? So mark those down. We'll have some information on those shortly. Again, I want to thank everybody who joined. I want to repeat something that caught my ear when Herb first came on. He said, we might not have everything together, but together we have it all. We might not have it all together, but together we have it all. And together Kurt does. I believe that we've got the finest information, resources, perspectives, connectivity that the industry can possibly find. We thank you for being a Kurt member. Thank you for supporting. Take care of yourself and each other. See you Thursday.